Every year, thousands of people end up in the emergency room because of sunburn. And every year, the incidence of skin cancer is rising around the world. In this video, we discuss the treatment and prevention of sunburn. Sunburn is a reaction of the skin to excessive solar radiation. Here, we're talking about two types of radiation, UVA and UVB, both of which can damage the skin and lead to wrinkling, premature aging, eye damage, and skin cancer. Sunburn may occur after as few as 15 minutes in the sun, and because of the delayed reaction, the full extent of the burn may not become apparent until after about 6 hours. Sunburn can occur even on overcast days in persons with sensitive skin, so we should always protect ourselves. The burn usually presents with redness, pain, and warmth, and if severe, can be accompanied by headaches, fever, and chills. Depending on the severity of the burn, it may then progress to blistering and peeling of the skin. It is usually at its worst from 24 to 36 hours after exposure and resolves within 3 to 5 days. Treatment of sunburn in adults consists of immediately removing yourself from the sun and seeking to relieve the burning sensation in the skin by immersing yourself in cool water or by applying cool compresses. It is not advisable at this point to apply soaps, since many of these can contain ingredients which can irritate the sensitive skin. You should then dry yourself in such a manner that the skin remains damp, and you should then apply a moisturizing cream to the surface of the skin, followed by a steroid cream such as over-the-counter 1% hydrocortisone cream. These will soothe the skin and decrease the inflammation. You also want to drink plenty of fluids to make sure that you stay hydrated. Natural alternatives to hydrocortisone cream and moisturizing cream are aloe vera and coconut oil. Now, if you choose to treat your sunburn naturally, then you would want to choose the pure aloe vera and the pure coconut oil, since products that contain additives can be irritating to the damaged skin. Aloe vera has been shown to decrease inflammation and to promote healing. And coconut oil is a moisturizer that acts by sealing the moisture into the layers of the skin, so that the best way to use it is to apply the pure coconut oil to the surface of the skin after cooling it with water and patting it dry. Coconut oil also contains lauric acid, which is a natural antibiotic and can prevent superinfection of the damaged skin. It can also act as a natural sunscreen, but its SPF value is just about 5 and does not block all of the harmful rays of the sun. You therefore do not want to rely on coconut oil as a sunscreen. Black tea and chamomile tea can be helpful because they contain anti-inflammatory compounds that can soothe the skin and help healing. Chamomile flowers contain alpha-bisabolol and matricin, which are anti-inflammatory. All teas contain tannins, but black tea contains the highest concentration of tannins, which are both anti-inflammatory and compounds that kill bacteria and viruses. Tannins are also antioxidants and can protect the skin from the aging effects of free radicals. These can be applied as chilled tea bags or as cold compresses. Oatmeal is thought to have both anti-inflammatory and antioxidant properties and can soothe the burning sensation in the skin. 1 cup of pure oats ground up into a fine powder in a blender and added to the water before taking a bath can provide some relief from the discomfort caused by sunburn. If you don't have oatmeal, you can try adding some baking soda to the water. Remember, these home remedies still have not been researched and proven to work, so that their use is based solely on anecdotal reports. The best way to take the pain and the burning out of the sunburn is to take over-the-counter anti-inflammatory pain relievers. Ibuprofen, naproxen, and aspirin can be taken in addition to the topical treatments described above. Research has shown that taking a single large dose of vitamin D, about 200,000 international units of vitamin D, can improve inflammation and the damage caused by sunburn. If your skin blisters, allow the blisters to heal. You should not burst the blisters since they help the skin heal and protect you from infection. If you develop extensive blistering, fever, chills, dizziness, or confusion, you should see your doctor. The best treatment for sunburn is to prevent it in the first place. Wear a broad-spectrum suntan lotion with SPF of 15 or greater when going outside, even for winter sports. The lotion should be applied generously to all areas of the body, including the lips, the nose, the face, the hairline, the neck, the backs of the hands, and the tops of the feet, and should be applied 15 minutes before going outside and reapplied every 2 hours or more frequently if you're sweating profusely or swimming. Wear a broad-brimmed hat, long sleeves, long pants, sunshades, and limit the amount of time you spend in the sun, especially when the sun's UV radiation is strongest, which is usually between 10 a.m. in the morning and 2 p.m. in the afternoon, and you should seek shade whenever possible. Remember that alcohol, salt water, and sweating can make getting a sunburn easier. Most importantly, do not tan. If you desire a tan, there are many sunless tanning lotions, creams, and sprays that can be applied at home or professionally. So what do you do if the years have passed and you've already had several severe sunburns looking back? How do you protect yourself from skin cancer? Well, you should see a dermatologist every 6 months to have a thorough examination to catch any suspicious lesions as early as possible. Thank you for watching. Like, share, and subscribe to the channel, and don't forget to hit the notification bell so you can receive notification when new videos come out. Until the next video, stay healthy and stay safe.